Hi, everyone. My name is Anne Marie Earhart, and I'm a licensed independent insurance agent working at John Boyd and Associates in Shelby Township, Michigan. And I am here to discuss the changes that are coming to Medicare for January 2025. So I don't know if you have heard that there are changes coming or not, but there is indeed changes coming to the Part D, which is for your prescription drug plan. So, whether you are on a standalone prescription drug plan, a Medigap plan, or Medicare supplement, or a Medicare Advantage plan, it is going to affect anyone who gets their prescription drugs through Medicare. So, I'd like to help clarify the information and hopefully help you better understand what's happening this year. So, on today's agenda, I will be covering the Inflation Reduction Act, the 2025 Part D changes, the Medicare prescription payment plan, the key changes to true and credible coverage when on a group plan. So I am sure that most of you know back in 2022, Biden and the administration passed a new law called the Inflation Reduction Act. And this law brought big changes to Medicare Part D. So last year, it was wonderful for all the diabetics. It did cap some of the insulins, making them no more than $35, which was wonderful because as an RN, I did run into a lot of people who had a really hard time getting their prescriptions filled when they were a diabetic. So I was really happy to see this cap on the insulin. But now we're going into phase two, and more changes are coming to your Part D. So, as I said in the first slide, whether you're on an individual prescription drug plan, Medigap plan, or a Medicare Advantage plan, these changes are going to affect you. And the Inflation Reduction Act is started in 2023 and it is supposed to continue through 2032. So, there's going to be big changes coming maybe every year. So I'd like to start and show you kind of what's changing and what our prescription drug plans look like right now. So if you look in the top white area, you can see plan year 2024. Right now, people first have to meet an annual deductible of $545. So that's the amount that people are paying out of pocket first before their initial coverage kicks in and the insurance company starts paying. So when you get done with that $545, then you have a copay or a coinsurance depending on where your medication falls on the drug formulary. And we'll get more into that. But that initial coverage phase goes up to the amount of $5,030. So if you're on a really expensive medication, you'll continue paying your copays or coinsurance until you get to that amount of $5,030. And then what happens is people enter the coverage gap, which is also called the donut hole. I don't know if many of you have heard of that. I remember hearing that all the time with my grandma when she was on Medicare. So, and it was always a big thing because her cardiac meds were not covered very well during this phase. So, when people enter the donut hole, beneficiaries are paying 25% of the medication if they're generic and 25% of the undiscounted cost of brand name drugs. And that continues all the way from $5,000 to $8,000. And so a lot of people on Medicare have a really difficult time when they're in the coverage gap. So if they're still on really expensive medications and they've gone through that annual deductible, initial coverage, now the cover gap, then they enter the catastrophic phase. So anything after $8,000 out of pocket, you enter that catastrophic coverage phase and they would pay nothing further for their prescription medications. So that's how it's been. So now if you look at the light blue area beneath, you'll see the changes for 2025. So for 2025, You are going to still have that annual deductible. So everyone is going to pay $590 out of pocket before their medication or insurance copay starts to kick in. And so when you get into that initial coverage phase, again, you're going to pay your copay or co-insurance for your medication based on where it lies on the formulary. But this time, you're only going to pay up to a max of $2,000 out of pocket. Once you get to that $2,000, that is where it ends. And there you will not go to the next phase, the coverage gap or the donut hole, because they're eliminating that. And so you will go straight to the catastrophic coverage where you will pay no more. So they are capping the max out of pocket for your prescription drugs at $2,000 for the year, which should be beneficial for a lot of people. So in that last slide, I showed you kind of in a graph what it looks like with the new changes. And so here's just a little bit of a different way to look at it. And so phase number one is going to be that deductible phase where everyone pays that $590 annually. And then the initial coverage phase begins where the member pays up to 25% coinsurance or a copayment on their covered prescription Part D drugs. The phase ends when you reach that max out of pocket of $2,000 for the year, and then you will pay nothing further for your medications. So, when we are talking about prescription medications, we need to understand there's something called TROOP. And what TROOP stands for is the true out of pocket costs when we're talking about prescription drug plans. And whether you're on a standalone prescription drug plan or a Medicare Advantage plan, the TROOP is what the insurance companies use to decide where you are in that chart, depending on your deductible, your initial coverage, or if you have met your max out of pocket and if everything is now paid for. So the troop includes things such as your deductible, co-payments, your co-insurance, but it does not include things such as the monthly premiums that you pay for your prescription drug plan or any costs that are paid towards non-covered medications. They have to be what's called on your formulary. On the next screen, I'm going to explain to you what that means if a drug is on formulary and it is counting towards your troop. So a drug formulary, ultimately, it's a list of medications, and there are hundreds of medications, and each insurance carrier does not cover every medication. So each insurance carrier is going to pick these couple medications, and they're typically going to include both generic and brand name drugs. By picking these two medications from each class, it's going to ensure that no matter what your medical condition is, they're going to have a couple medications that are within formulary for that drug plan. Because every insurance carrier does not include every medication, this is why you need to work with your agent because they're able to look at the different insurance carriers as well as the prescription drug plans that are offered and see if your medications are on that drug formulary. Because ultimately, you want your medications to be covered. Inside the formulary, all the medications are listed on different tiers. And on the next slide, I'll explain to you what tiers are. So now you've decided that your medication is on formulary with that insurance company. So now we're going to discuss something called drug tiers. And every medication is going to fit on a drug tier. And each company has different levels. So typically, the lower levels are going to be your generic medications that are going to be the least cost when you are filling your prescription. Then you have the middle tiers, and these are often include the preferred brand name drugs, which are a little more expensive than the generics, but they're less costly than the medications on the higher tiers. So then we go to the higher tiers, and these are typically the medications, they're non preferred brand name drugs. and the specialty medications. And these are going to be the most expensive medications. So just know that if your medication's on formulary, it then will fit into a tier level, which will tell you how much that medication is going to cost for your copay or coinsurance. Another part of the Inflation Reduction Act was they set up what's called the Medicare Prescription Payment Plan, or the MPPP. The Medicare Prescription Payment Plan is completely new. And what this is going to do is it is going to offer Medicare individuals the option that if they are on a really expensive medication that is going to cost them, for example, $600 coinsurance to pick up the first time they go to the pharmacy, that and they don't have that money at that time, it's not going to prevent people from going to the pharmacy and picking up their medication for zero cost. And then the insurance company sets up a payment plan with the individual for them to make payments or break that up over the next 12 months. This program is set to begin on January 1st, 2025, and it will be included in the standalone prescription drug plan as well as the Medicare Advantage plans. The Medicare prescription payment plan is something that you're going to have to enroll in. And on the next slide, I'll show you exactly how to do that. So, how exactly do you enroll in the prescription payment plan? So, for this, you are going to have to opt in. You can either enroll at the beginning of the year if you know you're on a medication that's going to significantly cost you at the beginning of the year. And so, right off the bat, they will spread your payments over that 12-month period. But let's say that you are on all generic medications and it doesn't cost you anything or very little out of pocket. And later in the year, you're prescribed a new medication. You can opt in at that point. So, people who know that they're on expensive medications that have a high copayment or coinsurance of um, over $600, they're probably going to be the best candidates for a program like this. And the insurance company will also notify the pharmacy if they see that you are going to be on a medication that's going to be higher cost. And so they will share that information with the pharmacy that you go to. So when you pick up your medications on pickup, if you're not aware of the program, they will let you know that the program is available and that you might be a good option for that. There is no cost to participate with this program. It's not saving you any further money. It's just helping you to spread that higher cost over the next 12 months. So it's more manageable to pay. What you need to understand is that not all medications are going to be able to be on this prescription payment plan. You can only put medications that are on the drug formulary on the prescription payment plan. This is only for people who are prescribed a medication that's on their drug formulary, and it's a high out of pocket expense. So, in regards to credible coverage, when you are 65 or still working and you're on your employer's group coverage, Medicare does require that anyone who's working for their employer, they need to make sure that they have a prescription drug plan that is considered credible coverage. And when they say credible coverage, what they mean is that your prescription plan needs to be as good as Medicare's or better. So your employer should tell you if your prescription drug plan is considered credible or coverage. And you do want to know that, because if you do not sign up for a Part D plan when you turn 65 and you don't have credible drug coverage, this could expose you to lifelong penalties that you could incur for not having prescription D credible coverage at 65 when you were first eligible. So you want to make sure that if you're on a group plan that it is considered credible coverage. And even though the Part D is changing and it is a law, things are still coming out from CMS that they're making changes. So this is one of the areas that I had already gone over. And since that recording, they've changed it. So we have been told that if your plan for 2024 is credible, that it should be credible for 2025. But I would just want to make sure that I was getting that notice of credible coverage from my employer just to make sure it's satisfying that Medicare requirement so you don't face any penalties. So, for a recap of the changes that are going into effect January 1st, 2025, it is getting rid of that coverage gap or the donut hole, and it is capping the max out of pocket for your prescription drugs at $2,000. So, a Medicare beneficiary will not pay more than $2,000 out of pocket for the year. Another part is that prescription payment plan that they are allowing people who are facing a large co-payment or co-insurance at the beginning of the year that they can set up that payment plan and opt in so that cost can be spread over 12 months. And that is going to be in addition to whatever your monthly premium is for that drug plan. So you would get one bill for your prescription drug plan, and then you would get a second one for your payment plan, dividing that into the 12 months. The annual enrollment period for Medicare is October 15th through December 7th, and that's when you're going to be able to change plans if you need to do so. So, what should be your concerns this year? Obviously, with so many changes to the Part D for your prescription drugs, that is a huge concern this year. With the changes to how much the max out of pocket is, we have not seen the prescription drug plans yet, but we know that there's going to be a lot of changes. This is going to be a huge year with everyone in the Medicare community checking their plans, making sure that their medications are still on formulary, making sure that they're signed up for that Medicare prescription payment program if needed. And, you know, if their medications are no longer on formulary, it gives you enough time to talk to your doctor to see if there's another medication in that class of medications that you can take that would be on formulary and covered versus one that's not on formulary. So, having the right insurance coverage can make a huge difference in what is covered and how much you're paying out of pocket for your plan and your medications. So, working with a trusted advisor is so important. So on the screen here, I just wanted to give you some uh, reasons of why it's so important and valuable to work with an independent agent. And so one, as an independent agent, we work with a multiple of insurance carriers. So we're not just looking at one insurance carrier and having to go with one of those. We are looking at several insurance companies and hundreds of plans to see which one is going to be the best for you. Two, we are talking to you. We're getting to know you and your situation so we can best put you in a plan that is going to work with all of your needs and help cover all your medications the best that they can be covered. Three, we are the experts in the insurance world. So, working with us, you're saving time and stress that you don't need to worry about by contacting somebody who does this every day. Four, we're going to help you compare plans, not just with one company, with many different carriers to see which one's going to be best for your needs. Five, we're your advocate. So we are going to do what's the best for you. We don't work for the insurance companies, we work for you, the client. So we want to make sure that you are taken care of. Six, the best part of this is completely free. We never charge our clients and we never charge for any of our services or our expertise. We get compensated from the insurance carriers, so we don't care what plan you go with. We are just making sure that we are doing the best for our clients because we work for you. If you don't already have a trusted advisor, John Boyd and Associates is here to help. We'd be more than happy to review your current coverage, make sure your medications are on formulary, and find the best coverage options for your needs. Remember, having the right insurance coverage can save you money and provide you with peace of mind. Don't leave it to chance. Work with a trusted independent advisor who can guide you through the process. Thank you for watching. If you found this information helpful, please like and subscribe to our channel. And if you have any questions, please feel free to reach out to John Boyd and Associates. We're here to help.